Hello, and a very warm welcome back to Young at Heart. I'm so glad we have this time to talk today, because we're going to discuss something incredibly important for your health and safety. I want you to think about your morning routine. For so many of us, it includes lining up a few daily vitamins next to our morning coffee or tea. Perhaps you have your multivitamin, some vitamin D for your bones, maybe some fish oil for your heart. You take them diligently every single day, and you do this because you are a responsible person. You care about your health. You want to stay strong. You want to protect your independence, and you want to be there for your loved ones for many years to come. It is an act of self-care. But as a doctor who has spent decades caring for the brain health of older adults, I have to tell you, there is one very common vitamin that I sometimes see on my patients' lists that frankly sends a shiver down my spine. Not because the vitamin itself is bad. It's actually essential. But because if it's taken incorrectly or without a full understanding of its power, it can dangerously interfere with common medications and, in the worst-case scenarios, dramatically increase the risk of a catastrophic event like a stroke. Today, we need to have a serious, caring talk about this vitamin. My goal is not to scare you, but to empower you with knowledge. Because being your own best health advocate is the most powerful tool you have. So what is this vitamin that we need to handle with such respect and care? It's vitamin K. Now, you might be thinking, Vitamin K, I've heard that's good for you. And you are absolutely right. But it's also what I call a double-edged sword, especially for seniors. To truly understand this, we need to walk through 5 critical points together. Think of this as your guide to safely navigating vitamin K. Our first critical point, understanding vitamin K's primary job. The clotting vitamin. Before we can understand the risks, we have to understand what vitamin K does. Its main role in the body is to help your blood clot properly. I want you to imagine your vast network of blood vessels, all those arteries and veins, as a complex system of plumbing in a house. Every now and then, a tiny leak can spring. Vitamin K acts as the foreman of a highly skilled construction crew. It activates a series of proteins called clotting factors, which rush to the site of that leak and form a perfect little patch or a clot to stop the bleeding. This is a wonderful, life-saving process. Without vitamin K, a small cut could bleed for a very long time. However, you can see how this power could become a double-edged sword. While we need our blood to clot to fix leaks, we absolutely do not want clots forming inside our blood vessels when there is no leak. An unwanted clot can travel to the heart and cause a heart attack, or travel to the brain and cause a devastating ischemic stroke. Let's think about a friend of ours. We'll call him George. George is a wonderful 72-year-old man who was diagnosed with atrial fibrillation, or AFib. This is an incredibly common heart condition where the heart's upper chambers beat irregularly. This irregular rhythm can allow blood to pool and form small clots. For George, the biggest fear with his AFib is that one of these clots could form, travel from his heart to his brain, and cause a major stroke. This is why his doctor put him on a special medication, which brings us to our next and most crucial point. Our second critical point. The dangerous dance, vitamin K versus blood thinner medications. This is the absolute heart of our conversation today, and it's the reason I, as a doctor, get so concerned. To prevent those dangerous clots from forming, George's doctor prescribed him a blood thinner, a very common one called warfarin, which you might know by the brand name Coumadin. Now, how does warfarin work? It works by directly blocking the action of vitamin K. It essentially tells that construction crew we talked about to take a break. It reduces the body's ability to form clots, making the blood thinner and less likely to form a dangerous one in his heart. I want you to picture a perfectly balanced seesaw. On one side, you have vitamin K, which is trying to make your blood clot. On the other side, you have the warfarin medication, which is trying to stop your blood from clotting. George's doctor very carefully adjusts his warfarin dose to get that seesaw perfectly level. This delicate balance is measured with a regular blood test called an INR test. The goal is to thin the blood just enough to prevent a stroke, but not so much that it causes dangerous bleeding. Now here is the shocking and dangerous scenario I have seen happen. George, being a proactive person, goes to the pharmacy and sees a bottle of supplements for bone health. He knows bone health is important, so he buys it. He doesn't realize that many bone health formulas contain high doses of calcium, vitamin D, and vitamin K, because vitamin K also plays a role in bone metabolism. George starts taking this new supplement every day without telling his doctor. What do you think happens to our seesaw? He has just piled a huge, heavy weight onto the vitamin K side. The supplement completely overwhelms the effect of his warfarin medication. The seesaw crashes down. His blood, which was being kept perfectly thin by his medication, suddenly becomes much thicker and starts to clot much more easily again. His protection against a stroke from his AFib has been wiped out, or even worse, his risk could be higher than before. He has unknowingly sabotaged his own life-saving therapy, all from taking a well-intentioned, over-the-counter supplement. This is the overnight risk that the title of our video refers to. A sudden, large change in vitamin K intake can rapidly alter your clotting factors, and for someone like George, this is a medical emergency waiting to happen. Our third critical point: the sneaky sources where vitamin K hides in your food. Now, it's not just about supplements. Vitamin K is naturally present in many healthy foods, and this is another area where understanding is key. The most famous sources of vitamin K are dark, leafy green vegetables. Think of things like kale, spinach, collard greens, Swiss chard, and turnip greens. Other vegetables like broccoli, Brussels sprouts, and parsley are also very high in vitamin K. When my patients on warfarin hear this, they often get scared. They say, "Doctor, does this mean I can never eat a healthy salad or have spinach again?" And the answer is a resounding no. Please, do not stop eating these incredibly healthy, nutrient-dense foods. Here is the secret. The goal is not avoidance, it is consistency. Remember our seesaw? Your doctor sets your warfarin dose based on your normal, average diet. If you normally eat a salad twice a week, that's factored into your dose. Your body is in balance. The danger comes from sudden, drastic changes. Let me tell you about Mary. Mary watched a health documentary and decided she was going to get incredibly healthy very quickly. She went from eating very few leafy greens to suddenly drinking a giant kale and spinach smoothie for breakfast every single morning. While this seems like a wonderfully healthy act, for Mary, who was also on warfarin, it was dangerous. She dramatically increased her vitamin K intake overnight, which made her blood thinner medication less effective. Her INR level, which had been stable for years, dropped to a dangerously low level. So the key is to be consistent. Enjoy your healthy greens, but try to eat a similar amount each week. Don't eat almost none one week and then huge amounts the next. A steady, consistent diet allows your doctor to keep your medication dose stable and safe. Our fourth critical point: are you at risk? Who needs to be extra careful? This information is most critical for a specific group of people. You need to pay extremely close attention if you or a loved one fall into any of these categories. Anyone taking the blood thinner warfarin, Coumadin. This is the #1 group. Anyone with a diagnosis of atrial fibrillation, AFib, as this is the most common reason for being on a blood thinner. anyone with a history of blood clots, such as a deep vein thrombosis, DVT, in the leg or a pulmonary embolism, PE, in the lungs. Anyone with a mechanical heart valve, as these valves require lifelong therapy with blood thinners to prevent clots from forming on them. Now, a quick but important note. Many people today are on newer blood thinner medications like Eliquis, Xarelto, or Pradaxa. These are called DOACs. A major advantage of these newer drugs is that they work differently and are generally not affected by your vitamin K intake. However, this does not give you a free pass to take any supplement you want. It is still critically important to have a conversation with your doctor before adding any new supplement to your routine, as there could be other unforeseen interactions. Our fifth and final critical point, the safe path forward, how to be smart and empowered. After all this information, I don't want you to feel anxious. I want you to feel prepared and empowered. So what is the action plan? How do you move forward safely? It's very simple. Rule number 1, talk to your doctor. This is the golden rule. Before you start or stop any new supplement, whether it's a multivitamin, a bone health formula, or an herbal remedy, you must discuss it with your doctor or pharmacist, especially if you are on any prescription medications. The best practice? Once a year, put all of your pill bottles, prescriptions, and over-the-counter supplements in a bag and take them to your doctor's appointment for a full review. Rule number 2, strive for consistency, not avoidance. Again, please continue to enjoy your healthy, green, leafy vegetables. They are wonderful for you. Just aim for a consistent weekly intake. Don't make sudden, dramatic changes to your diet without talking to your healthcare provider, especially if you are on warfarin. Rule number 3, read your labels. Become a savvy consumer. When you look at a multivitamin or a bone health supplement, turn the bottle around and read the supplement facts panel. Look for vitamin K. Sometimes it will be listed as K1, phylloquinone, or K2, menaquinone. Knowing what is in your supplements is a key part of being in control of your health. Rule number 4, know your numbers. If you are on warfarin, you know the importance of regular INR blood tests. This is your safety check. It ensures your seesaw is balanced. Never skip these appointments. And if your results are out of range, talk to your doctor about any recent changes in your diet, medications, or supplements. By following these simple but vital rules, you transform yourself from a passive patient into an active, informed, and empowered partner in your own healthcare. So, let's take a deep breath and bring it all together. We've learned today that vitamin K is an essential nutrient, a friend to our bodies that helps us heal. But for those of us on specific blood-thinning medications like warfarin, it's a powerful substance that must be treated with understanding and profound respect. This conversation was never about creating fear around a vitamin or a healthy food. It's about shedding light on a hidden danger that can arise from a lack of information. It's about understanding that well-intentioned actions, like taking a new supplement, can have unintended consequences if not discussed with your healthcare team. The ultimate goal is for you to feel confident and safe. The most powerful takeaway is that being an active participant in your own healthcare is not optional. It is essential. Open and honest communication with your doctor is your greatest tool for safety. So what is the one simple, powerful action you can take today, right after watching this video? I invite you to go to your medicine cabinet or wherever you keep your vitamins. Pick up your multivitamin bottle and any other supplements you take. Turn them around and read the labels. Just see if vitamin K is listed. If it is, and if you are taking a blood thinner like warfarin, you now have a very important and specific question to bring up at your next doctor's appointment. This simple act of checking a label is a powerful step toward taking control and ensuring your own safety. Remember, your health is a journey. Staying informed, asking questions, and working as a team with your doctors and pharmacists are the most important habits you can ever cultivate. If you found this information valuable and caring, please consider giving this video a like to help it reach other seniors who need to hear this message. And please, subscribe to the Young at Heart channel so we can continue to share trustworthy, life-saving health information with our wonderful community. Thank you so much for your time and your trust today. Be safe, be informed, and be well. I look forward to seeing you again right here in our next video.